Hello everyone, let me briefly introduce myself. My name is Abbas Zakeri and I'm delighted to be here today to talk about COVID-19 outbreak. I would like to take this opportunity to talk to you about one of my papers, an abstract of which was submitted at e-conference of University of Malaya, Malaysia. The title of my article is Burnout, Anxiety, Stress and Depression among Iranian nurses before and during the COVID-19 outbreak. My presentation is divided into three parts. I'll start with introduction, then I will look at method, and finally I will talk about result. In introduction part, I'd like to give you some background information about health challenges during the COVID-19 epidemics. Frontline nurses faced many health challenges during the COVID-19 epidemics, are directly at risk during treatment and care of COVID-19 patients. As a result, the factors can have an impact on nurses' job performances and health. The purpose of this study was to compare burnout, anxiety, stress, and depression in nurses before and during the COVID-19 outbreak. I'd now like to move on the next part, methods. Our study was a cross-sectional study. We assessed 266 frontline nurses before and 242 frontline nurses during the COVID-19 outbreak, with 1 year apart in 2019 and 2020, two-stage sampling. The data were collected using demographic questionnaire, mustache burnout questionnaire, and depression, anxiety, and stress scale in public hospital in southern Iran. That's all I have to say about methods. Turning our attention now to results. There were no significant differences between groups in subscale of burnout, p-value greater than 0.05. Anxiety, stress, and depression scores significantly increased during the COVID-19 outbreak. Compared with before the COVID-19 outbreak, p-value less than 0.05, there were significant differences between groups in level of anxiety, p less than 0.001, and stress, p equals 0.04. Before the COVID-19 outbreak, burnout predicted 11%, 15% and 30% of the variance of anxiety, stress, and depression, respectively. In addition, stress, monthly working hours, and shift were variables that predicted 16% of variance of burnout before COVID-19. The result of the present study showed that burnout during COVID-19 didn't change significantly compared with before COVID-19. Anxiety, stress, and depression increased significantly during COVID-19 compared with before COVID-19. Thanks for your attention.